Welcome to Scoop and Scale, where we dish up the science and weigh facts about mostly equine nutrition. I'm Jill Jackson, lifelong equestrian, podcast producer, and owner of 3 ponies. I'm a dressage rider and at-home horse keeper, living the challenge of managing 3 easy keepers on multiple acres of Iowa pasture.
And I'm equine nutrition consultant, Dr. Clair of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and pony club mom.
Claire and I have been horse friends for almost 20 years, and we've been collaborating on this podcast for the past year. And like most good horse friends, we're always talking horses. We're always talking about the challenges of managing our horses, our riding struggles, feeding horses, and what's going on in the wider equine community. This podcast is a place for us to have conversations mostly about equine nutrition. It's for anyone who wants to make better choices when it comes to feeding their horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. And while I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
Thank you for joining us and hope you enjoy the following episode.
One of the most common issues that owners reach out to me wanting help with is managing their horse that's been diagnosed with ulcers or who they believe have ulcers. Some of these are chronic cases, and I always knew that ulcers were tricky to manage, but it wasn't until I had my own run-in with them with my horses that I got to experience that firsthand. They're extremely frustrating and also expensive to deal with, and they make our horses truly unhappy. Our listeners have repeatedly requested that we do an episode on gastric ulcers, and today is your lucky day because we're thrilled to be joined by Dr. Phoebe Smith. Dr. Phoebe is a board-certified internal medicine specialist and runs a niche practice, Riviera Equine, covering the Central Coast and southern parts of California. And I've been lucky enough to help provide nutrition support for some of her clients. Dr. Phoebe, welcome. Thanks for being here today.
It's my pleasure to be here and talk with you about gastric ulceration.
So, as an internal medicine specialist, you consult on gastric ulcers. Why do ulcers fall under that specialty?
That's a good question. Really, internal medicine involves all the internal organs. And because gastric ulcers can occur as lone findings or they can occur as part of a bigger health picture, that's why they fall under the internal medicine umbrella.
So what exactly are gastric ulcers? Starting at the very beginning for people that don't have any idea what we're talking about.
Sure. So gastric means stomach, and ulcer, I think we all can sort of picture what that might mean. Gastric ulceration is an erosion or ulceration of the surface of any part of the stomach. There are a lot of words that are used out there to describe gastric ulceration, and a lot of times you'll hear about something called hindgut ulcers that's often confused with one type of gastric ulcers. So I just wanted to sort of simply say gastric means any part of the stomach.
Yeah, I think I definitely hear, I've had clients say that they think their horses, they talk about hindgut ulcers, and we're going to get into this in a minute, but they're meaning
Correct.
something, a completely different area of the horse's intestinal tract. And they're thinking that one type of gastric ulcers that we'll talk about are hindgut ulcers, and they're not. And we can clear that up in a little minute when we get to chatting about that.
And fair enough. I always understand when somebody comes with that.
Right? It's confusing.
It takes a minute to sort of work through it, but then like, right, okay, because we picture this round thing being the stomach, and it turns out the stomach's not really this perfect round, bowl that receives the food. It's a funny shape, and it has this little, cavern down, a second little cavern down lower before it goes into the small intestine. And so sometimes that gets referred to as hindgut, and when it's actually part of the stomach.
Claire, you mentioned you went through this recently. What led you to think that your horse had ulcers?
I was lucky to go through it twice. I have 2 horses and they both had ulcers. Yeah, what led me to think that they had it? So the first one, this was last year, it was my daughter's pony. We tend to go back to the UK periodically. We were away for Christmas and the pony was in training with our dressage trainer. So I went to a different property for 2 weeks, came back, then went to an IEA show. The weekend he came back. Then he was back from that for like 3 days, went to a rated dressage show for 3 days, did brilliantly, won several classes, really fabulous. And then 10 days after that, would not canter, and was just pretty miserable. Like you put your leg on and it was like the life just sucked out of him, and if you got more demanding about it, he started kicking out at the leg, going into the canter. And the timing of the things, right? The timing of going away to a trainer, coming back and going to a show, coming back and going to another, knowing what I know, I was like, okay, the number one thing that comes to mind is ulcers. So we're going to get him scoped. And sure enough, he did have some ulcers. And then with my horse that I purchased this January, he was a little different. He lovely under saddle, no issues there at all, but was underweight, right? Really sort of lacking top line, didn't have a great, and some of that was he hadn't been in a ton of work. So it could have just been that he just needed to be in a better exercise program. But he also had a very negative saddling experience, right? So you'd put the saddle on, extremely girthy, angry, ears pinned, head up, stomping his feet. You had to be careful not to have your feet by his left front because otherwise you'd get your toes trodden on. Just really miserable about being tacked up. And I knew he had been in a saddle before I purchased him that hadn't fit. So some of that was PTSD from saddle fit. But again, I was just like, looking at this slightly unthrifty looking horse and this negative, anticipation of being worked, let's get him looked into as part of peeling away the layers of his sort of onion to figure out how to make him, a better performance horse. And similarly, he had similar issues.
Dr. Phoebe, can a seemingly healthy horse have ulcers?
They can. There's more to that. Yes. I think what we all thought of as the classic ulcer presentation, some of which your horse, it sounds like Clair presented, right? Sort of the
right.
Maybe, weight loss, poor top line, poor hair coat, girthiness might be a more classic presentation of what we'd think of. But there are many far more subtle signs that are not always picked up on. The sort of one caveat to sort of keep in mind, and I'm betting we'll touch on this as we go through the conversation, is that there can be the presence of ulcers in horses who are outwardly healthy and there are no complaints by the owner, by the trainer, and yet there are some gastric ulcers. And so the million-dollar question there is, how clinically relevant are those ulcers? And I don't know that we have the answer yet, but I'm sure we'll get into that a little bit more.
I always feel like it's a little bit that, that whole saying of if a tree falls in the forest and there's nobody there, does it make a sound? Right? It's a little bit like, if you have no presentation and you went in and scoped the horse and there's ulcers, like you said, is that clinically relevant? It's sort of...
Well, right. And so sometimes we are asked, and sometimes we do scope an entire barn, right? An entire training facility or a big chunk of them. And I do always have a conversation ahead of time that let's do this to understand the prevalence of ulcers. Like I want to know each individual animal's, what they're doing and what your concerns are, just as each one is brought up. However, the reason to go through and scope everybody is more about if a lot of these horses have ulcers, there's some management changes that we need to make. If that makes sense, rather than
totally,
we need to identify every single one who does. So sometimes it's not every single one. Sometimes it's, they pick a portion of them. More to understand management and nutrition. And are there changes that need to be made sort of more globally?
Yeah, that's a useful tool when it's used that way, I'm sure. And hopefully then you're getting ahead of potential issues.
I always appreciate it when we're asked to do that, to sort of look at and understand. There's definitely value in scoping the individual horse. And I would say that we do that more often. But when we are asked to come in and sort of scope a barn or scope, a big chunk of horses, it is for, the trainer wanting to know, and I make sure they understand this is so we know, how are we doing sort of in general with all of these horses? Are there things that we need to change?
Is scoping the only way to know if a horse actually has ulcers?
It is. It is currently. There have been a couple of other tests that are sort of less involved that have been put out on the market, but unfortunately, they're not able to reliably diagnose ulcers. I wonder in the future, might there be something, whether it's a saliva test, which would make a little bit more sense maybe than a fecal test? Would there be a blood test that would help diagnose? I will say, in addition to, does the horse have ulcers? That's sort of the minimum question we're actually trying to answer when we scope. What is the distribution? What tissue type are they in? Where in that tissue type are they? And so I'm not sure that a test without looking is ever going to be able to answer those things, if that makes sense. It wouldn't be able to say, yes, the horse has squamous ulcers and they are focused at the lesser curvature. That's interesting. But that is relevant. That totally is relevant, right? So
yeah. So right now, if someone, AI tells you that's the solution, we know that's not real. That truly is made up because we're not there yet. You gotta look.
In the world of internal medicine, very few things are black and white at all, right? We deal in shades of gray. And I always say, I love scoping because it's black. You either have ulcers or you do not. And we can, all the different ways to dissect that and look at what type of ulcers and severity, et cetera. But it's pretty black and white. That's the beauty of scoping.
Yeah, for sure. And actually, to your point, it was funny because when my daughter's pony was first scoped, I took him up. I have a fabulous vet clinic I work with here, and they have blessed with a number of board certified specialty veterinarians there. And I have my sort of performance lameness rehab vet is board certified. And I took him up there, and I said to him, I said, look, I've prepared him to be scoped, but I'm bringing him to you because if this issue is not ulcers, there's clearly something else going on.
Exactly.
I need the whole picture. And, he looked at him and he said, he looks stunning. I mean, his coat was great. And he said he doesn't look like he's missed a meal a day in his life. He's like, he doesn't have ulcers kind of thing. And I said, well, he did this morning and he's pretty grumpy about it. So can we please scope him? And they had a new scope and they scoped him and, went in and his squamous tissue was gorgeous. And, and so my vet who does the more lameness side of things said, see, I told you that's not what the problem was. And the internist said, just hang on a minute. We've still got to go around that lesser curvature and kind of get into, and then lo and behold, there it was kind of thing. And it was a really good lesson for everyone. I think standing there that just because the pony came off the trailer fat and shiny and looking great, you can't tell from the outside always looking in. And, his thing was behavioral, his coat and everything was lovely. So it isn't just, you have to look at the big picture and you do have to get in there to look.
Oh, I was just going to say that's the perfect example. I'm sorry that your pony is the perfect example.
I know, but it really was, and it was a good lesson too. In that he, is a fabulous veterinarian, but is generally looking through things with the lens of lameness because that is again his specialty. He spends all day looking at lameness, and he really felt that there was a little something somewhere in a joint, and there probably was as well. But there was. Like, unfortunately, with most of these horses, it's a multifaceted thing, and you have to go looking.
And I was just going to add that I had a pony that presented with every clinical sign. He's a worrier. He paces in his stall when he goes to shows. He has loose manure as soon as he gets into the trailer. Uncomfortable getting tacked up. Took him and got him scoped. Found nothing. So there's always that too. You never know.
That is also a great point. And, when people feel maybe sheepish, like, well, I really thought he did. And it really, negative, a clean scope is equally valuable information, right? In your horse, in the case of, Claire, your horse, or the pony, if the scope had been clean, okay, we have some behavioral issues. What else could be driving it? And so I think a clean scope is also super valuable information. It's not, money wasted, in my opinion.
Yeah, I agree. I only had to pay for the scope and didn't have to go through the process and keep repeating, and then you just move down the line to, okay, what's the next thing we're going to try? Like, we have to look somewhere else for the issue.
Right.
Yeah.
Yeah, for sure. And so it kind of brings me to a point where I feel like years ago, I'm terrible at time, so who knows how many years ago, but it wasn't uncommon for it could have been yesterday, could have been 10 years ago, who knows. I feel like it wasn't uncommon for people to sort of say, okay, well, like Jill's pony, like looks like just give it GastroGuard for a week, and if it looks happier at the end of it, then you've got ulcers, keep going till the end of 28 days. And what I'm hearing you say is that's not going to work either always. And it's not, you need to scope. Is that right?
it's not going to work always, for sure. You're right. That was something that was done quite a bit more previously, before the advent of so many clinics having scopes, right? A lot of veterinarians have gastroscopes now. And so I think we can be much more specific, and we can talk about why 28 days of GastroGuard is not always the answer, right? I mean, in some cases, that's a lot of money to spend if it's not ulcers, right?
Right.
It's a wonderful drug and it is not cheap, but it may not be the only drug that's needed. There may be, again, management changes. There may need to be feed changes, exercise changes, lifestyle changes, depending on what is observed on the scope. So I really do think that scoping is worth it if it's, highly likely.
One thing I forgot to put in my notes that I was going to ask you, but I think this would be a good time to ask you, and we should ask you, is for listeners who have got to this point and they're going, oh my gosh, I think I should get my horse scoped. What are they going to need to expect as far as the preparation? Because there is a little bit of prep. You don't just roll into your vet clinic and have your horse scoped.
Order up a side of stomach scope. Yes.
Yes.
So the horse has to be fasted, and everyone has a different protocol. Our protocol is 14 hours off feed and 3 to 4 hours off water. And so what my office has definitely helped me with is off feed doesn't just mean don't feed them anymore. It means remove all access to feed. And so many of our barns will use the nylon. They're actually feed bags, which if the horse is new, that might seem kind of wrong to do, but put a feed bag on a horse that we're fasting. But using those nylon feed bags to prevent consumption of scraps that remain in the bedding. A desperate horse will sometimes even eat manure. I like to say it's just like twice baked potatoes. It's not that weird for them, right? If they eat a manure.
Right.
And so the muzzle really helps, prevent consumption of little bits of bedding or scraps or whatever. And then water, again, 3 to 4 hours, sort of depending on what time we're going to be there and what time they can pull the water.
Yeah, I learned that the hard way. I showed up for my first scope with the pony to find him eating the shavings.
Mm-hmm.
Because
especially
there's
a pony.
itty bitty,
I mean,
I know, right? Itty bitty tiny pieces of hay in there. And so then the next time I had him scoped, I bought a muzzle to put on. Jill is the muzzle queen. She has ponies and lives in Iowa, so they live in muzzles on the pasture. And I had this muzzle, funny story, and Jill's like, you're going to have to tape the top of the muzzle to the top of your nose band at the top. The type I had bought had nothing at the top. It only had the connection side to side and one under the chin. And she's like, you're going to have to connect it in the center of the nose. And I was like, oh, don't be ridiculous, kind of thing. It's fine. Anyway, I went out the next morning. The next time we scoped him, he'd got the whole muzzle under the chin. Muzzle under the chin, because I had not taken the advice from my friend, the muzzle queen, and I had not attached it at the top. So I just throw that out there for anybody who decides to put a muzzle on at night. You do sometimes have to really attach them to the halter.
You might have to make some adjustments in every corner and every attachment just to be sure.
And we have a couple of barns, after they've had one escapee, like you're talking about, get out of their muzzle, or some of them get really clever and kind of turn their head sideways and then use it as a bit of a scoop, and scoop something into it. And so they will double muzzle or use these kind of thin nylon feed bags as a muzzle and then put the sturdy grazing muzzle over it that's a bit, snugger to the cheeks. So, necessity, the mother of invention. Absolutely. I have to tell you, one of the greatest, we arrived at a very lovely dressage barn, and I see the patient that we're supposed to scope on the urocizer. So he's walking, and he has the weirdest looking thing around his muzzle. Isn't that who we're scoping? Well, something, I don't know if he had destroyed the muzzle, and the trainer having had scope before where there's feed in the stomach was, saying, well, not on my watch is this happening. And so she used a fly mask to create, or two fly masks, and created, a muzzle for the horse, and then put him basically on the walker.
Keep it moving.
I mean, full credit to that trainer.
Wow. We had one where he actually he did have his water taken away 3 to 4 hours before. And this was a big warm blood, so didn't have that pony, like, got to eat everything type mentality. But what he had done is he'd obviously gotten bored, so he just drank all night. And he was completely full of water, even though they took the water away 3 or 4 hours before. Like, he'd obviously just been drinking. I mean, there was like, the vet put the scope in, and she's like, this is like going down in the Odyssey underneath the ocean. She's like, I can't see anything. So he actually turned out that they couldn't scope him very well, but they actually decided that he obviously had something going on where because he shouldn't have had that much water in him.
Right.
There was something weird going on with him, but like, he had obviously drunk quite a lot. So they ended up taking his water away earlier when they re-scoped him.
Sure.
And then he was okay. But even then, he still had some stuff in there. He had delayed gastric emptying, I think, was part of his issue. So yeah, sometimes you never know what you're going to find when you go in there.
Well, and occasionally there's a horse who requires a little longer fast. And those, we record all of these specifics down to exactly how much sedation was required and how effective it was, so that on subsequent scopes, if we look like, oh, this one actually needs an 18-hour fast. Okay, fine.
That's awesome. Yeah.
As a horse owner, why should I care what type of ulcers my horse has? Why does that matter?
Good question. It matters because the treatments are different. Squamous ulcers, so there are basically 2 tissue types in the horse's stomach. And squamous ulcers are the ulcer types that we all probably originally thought of stomach ulcers occurring in. And in general, squamous ulcers respond to acid suppression, and that is best achieved through the use of GastriGuard or UlcerGuard, and we can talk about that. But they respond really, really nicely to acid suppression, because ulcers in the squamous tissue occur when there's increased, sort of inappropriate for that horse, contact time of all the acids, all the stomach acids, with that tissue. The other ulcer type, glandular ulcers, that occur sort of in the bottom of the stomach, and also in this area many people have heard of now called the pylorus, which is not really a mystery place. It's just this little section that's beyond the main bowl of the stomach, this little anteroom right before going into the small intestine. So that area is a common site for ulceration in the glandular tissue. It's a different tissue type, and ulcers in this area do not respond to GastriGuard alone. So it would be a super bummer to give 28 days of GastriGuard, right? Like, okay, that'll probably work. And then the problem is not solved because GastriGuard is an expensive drug. And so I think that's the reason to scope and know what type you have.
That was my personal experience. I mean, honestly, it saved me a huge amount of money to know what I had and to be able to then medicate more appropriately for the kind of ulcers we were actually dealing with.
Exactly. I mean, what a bummer it would be to spend, more than $1,000 on meds and then go, and then, maybe get the horse scoped and go, oh my gosh,
right.
We have ulcers, in the pylorus. We basically are starting all over with medication.
Yeah, for sure. So how prevalent are ulcers in our performance horse population? And, I know there's like studies on it. I'm curious, studies, but also like your personal experience. You're out there seeing a lot of horses. Like, what's your personal feeling about prevalence?
They're very prevalent in our performance horses, both English and Western performance horses. And you're right, there are a number of studies looking at specific disciplines. But I sort of appreciate your question of like a more step back general. Granted, we are often scoping the horses that someone suspects has ulcers, so it's a little bit of a skewed population, right? But if we were to sort of combine all of the studies that have looked at everything from endurance horses to jumpers, dressage, race horses, Western sport horses, the number is a little tough to swallow. I mean, if we were to combine all of those, we're in the 80% ballpark of horses who are in a full training program. That's a lot, right?
That's a lot.
That's a lot.
Yeah. So is there a group, do you think, that's more at risk than others?
You mean like a discipline or a breed?
As far as for the squamous ulcers, because I know there's also been some sort of research looking at, I feel like I heard, read something like the race horses and the endurance horses, get a lot of squamous ulcers, but maybe less glandular ulcers. And then our sort of performance horses that we think of, sort of the English disciplines, and I'm assuming that would also include some of the Western disciplines, perhaps they see less squamous, but more glandular.
Well, yes, and.
Always and, right?
Right. It's true that our racehorses, both thoroughbred and standardbred, in all of the sort of, and all the studies have shown a higher incidence of squamous ulceration than these other disciplines. Is it that those breeds are more prone to it, or is it the management of horses in those disciplines in terms of feed withholding management, the time spent in a stall, et cetera? A number of the factors that we know can be attributed to ulceration are part of how the lifestyle of those horses.
Right, because that kind of ulcer is really like the acid splash type of ulcer, right? So if you're withholding feed and you don't have a lot of food in there to absorb that acid and stop it splashing around, common sense says you're going to be more at risk of like acid splash related ulceration.
Correct. And you can see both types in any type of horse. You can see both or one in any breed and any discipline, I would say.
So the squamous ulcers we typically think about when someone says gastric ulcers, and that we treat with GastroGuard. Is that right?
We treat with GastroGuard squamous ulcers, and I'm often heard saying, diagnosing is step one, treating is step two, and the severity may dictate changes beyond medication. And then we have to work out how to prevent recurrence. So I guess I say that like the simple answer is yes, we treat with GastroGuard. However, it's not a treat it and it's behind us, if that makes sense. We have to think about how to prevent recurrence.
So it seems like we don't have such a good understanding of glandular and pyloric ulcers as far as perhaps what causes them. And obviously, having had two horses with, pyloric ulcers, they're really frustrating and time consuming. And what's our current understanding on what perhaps is leading to those occurring?
Well, you're right in that the body of knowledge is much more solid in the area of squamous gastric ulcers. With glandular ulcers, there's a lot of great work being done. So, maybe we have this conversation in a handful of years and right. We'll be able to talk about it a little differently. Ulcers in the glandular portion seem to be a breakdown of the normal defense mechanisms. So the body's way of not getting ulcerated. They do seem to be more prevalent in warm bloods, but I have absolutely seen glandular ulcers in every breed, in Western performance horses, in ponies, in all sorts of things. And so I think breed is not the only thing there. It's not as simple as contact time with acid. You're right. There's more to it. And maybe there's some genetic predisposition. Maybe there's some interesting work that takes into account, in a nutshell, sort of what type of horse, right? The stressful type of horse, like Jill was saying, that it probably won't surprise you that type of horse sometimes, though not always, clearly, is more likely to develop ulcers. I sort of jokingly, sort of not jokingly, often say that the externalizers, the ones who tell you exactly how they're feeling, I'm stressed out right now, are less likely to have ulcers. And the ones who sort of, grit their teeth and suffer through it, the internalizers are more likely to. That's certainly not a perfect science, but sometimes we see that. It's really interesting to me, some of the studies that are being done that look at, I guess, management and how that relates to the presence of ulcers. Because I think we forget that, right? We delve into the medicine and we forget about the horse being a herd animal. So the things that have been found are in the studies that actually I see in practice as well. Number of handlers. I thought that was a fascinating one.
Oh, that is interesting. Yeah.
Number of handlers, number of riders, number of days, consecutive work days, number of really days per week.
Yeah.
Right?
Yeah. And I think we see that. I know a number of trainers who grew up in the model of you ride the horses 6 days a week, right? They work 6 days a week and have dropped back to 4 days a week. Not anything to do with ulcers, just for whatever life reasons, they've gone to working their horses 4 days a week. And they've all gone, you know what? The horses go as well, if not better, than they did when I rode 6 days a week. So I think that's a really, that piece of research you're sharing is a really interesting, because I think it actually goes beyond ulcers.
I would agree completely that the psychological component, which is no small part of the ulcer, syndrome, truly. I have really enjoyed seeing this work published because it does mirror, what I hear. I scope a ton of horses and it really fits with and really sort of supports what I'm trying to do. And when I see owners, and trainers willing to give the horse the time, then we do see, resolution and reduced recurrence of ulcers.
That's cool. And in so many ways, that's such a simple thing for us all to do.
Truly.
Ride one less day a week.
In theory, it's simple to do.
Jill really likes to go ride.
I'm a 6 day a week rider. It's been really hard for me to be like, it's okay. We can just ride 4 days a week. It'll still be the same.
Right. Maybe. I bet. It's hard for a lot of people, but minimum 2 consecutive days off, and that's been hard, right, for people to sort of wrap their arms around. But no, I'm not looking at you, Jill. Don't worry.
I scoped. We don't have ulcers. We're fine.
Exactly. Right. Just because he has diarrhea when he gets in the trailer, right? Anyway, I thought that was a fascinating one. Just the number of consecutive days of work, the lack of, particularly here in Southern California, where land is at a premium. Horses don't get out a lot of places, and I work with some really nice training barns who have found a way to put up. Even there's also very little green grass in Southern California, so the farms that don't have green grass have found a way to just put up some pens and. I'm thrilled with the ones who will turn horses out even overnight, the ones who really need it. And that's a big deal for a show barn to do, right? Leave a horse outside in a pen, and they're super nice horses and they're, and doing all the shows, but the horses are happier and they see the results. And I'm super proud of those barns who figure out what they can do with what they have. When we talk about all these factors, the very things that we're talking about right now, the number of handlers, the number of riders, and the days off, contact time with other horses. That's a tough one, but they at least need to see other horses, and they can outside better than they can in the barn usually. But ideally they can, touch each other. And so anyway, I'm super pleased when I see barns come up with ways that they can incorporate some of these things to the best of their ability.
And there are ways to do it that the horses can stay safe.
So if my horse has glandular or pyloric ulcers, is GastroGuard the treatment to use? The same way that we would use it for squamous ulcers?
For horses with glandular ulcers, GastroGuard is one of the drugs you'll use. One is not sufficient, though. And so the first line of therapy for glandular ulcers is GastroGuard and sucralfate. GastroGuard being the acid blocker that we talked about with squamous ulcers. We want to increase the pH in the stomach. And then sucralfate for glandular ulcers works in 2 ways. We know that GastroGuard alone for glandular ulcers has a very, very low rate of healing them. I mean, it's in the teens or something. And so the addition of sucralfate, you're suppressing the acid with your GastroGuard, and then sucralfate, again, for glandular ulcers, works in 2 ways. And one is sort of directly as a bit of a topical Band-Aid right on that ulcer bed. And that's sort of easy, I think, for all of us to picture that seems like a good thing. And then it's absorbed and acts systemically as well to promote some of the healthy defense mechanisms that area needs in order to maintain a healthy barrier against acid. And so we really do need both in order to heal glandular ulcers.
So another drug that I've heard people using when treating these, especially the glandular ulcers, is misoprostol. And I wonder if you could speak a little bit about what that drug is, how it works. Is it different in how it works from Gastrogard and sucralfate?
It is. It's an entirely different drug. So a third drug that is commonly used to treat primarily glandular ulcers in the horse is misoprostol. It's a prostaglandin analog and is proposed to work in a couple of different ways, one of which is blocking acid release. And then the other proposed mechanisms have to do more with a similar way that sucralfate works in terms of helping sort of boost the natural defense mechanisms. It is used, it's not considered first-line therapy for most. It's an interesting drug, and in some cases, it really does help heal ulcers. In other cases, it doesn't. And in a third category of cases, it actually creates squamous ulcers. And I've done this myself, put a horse on misoprostol, and it's either misoprostol and sucralfate, or occasionally all three drugs. And talk about tricky timing. You need like a spreadsheet to work out when you're giving what and when you're feeding, because you don't want to give those, sucralfate and misoprostol together. Misoprostol really, if it's used, should be given 3 times a day based on some of the pharmacokinetic studies that have looked at, sort of how the drug works in the horse's body. And so for me, it's not, and for, I would say, the current recommendations, it's not a first-line therapy. But it certainly is a tool in our arsenal if needed. And in cases that are maybe non-responsive to Gastrogard and sucralfate, it is something to consider. There are, of course, some potential side effects that are in humans. It can cause abortion. And so handling has to be just with care. And then some horses will get some GI discomfort, diarrhea, gas, colic on the drug. I haven't seen a ton of that when using misoprostol. I've actually seen more commonly the development of squamous ulcers while on it, which is super frustrating. Like, good news, pyloric ulcers look better. Bad news, we have brand new squamous ulcers.
So now you need 28 days of Gastrogard.
I mean,
oh my gosh.
Nobody's happy then. So not a first-line therapy for me, or in the sort of current recommendations. The European College of Internal Medicine put out recommendations about gastric ulceration and sort of updated them a year or so ago. And that has remained the same. But I know it is used a lot. And I think in some cases, it certainly does help. One of the things that I do see is there's a fair bit of compounded misoprostol and compounded sucralfate used. And that just troubles me a little bit, because with no regulation, you don't really know what you're giving the horse. Is it really getting 8 grams of sucralfate, right? Is that really what's in this scoop? And so if the horse doesn't respond, is it because the drug didn't work, or is it because that compounded product, and this would go for a compounded omeprazole product as well, didn't really have the thing that it said it did? And so I would caution against the use of compounded drugs in the treatment of gastric ulcers.
Yeah, that makes sense. And having used misoprostol to treat the pony, I can say that he did develop some loose manure. And we did have another horse in the barn who, unfortunately, through a miscommunication between who was giving what meds when type situation, we had a mare who, she was on misoprostol as part of her treatment and suddenly became really crabby, kind of out of nowhere. And really, she was under saddle being ridden. I remember saying to the cat that she almost looks a little colicky, like she was just, swinging her head around, looking at her belly and really not happy. Well, it transpired that she had she'd gotten a little more misoprostol. It wasn't more than was safe or anything, but it was a sudden increase in the dose than what she was used to getting. And she was pretty sensitive, and she had a pretty strong behavioral response to it. I mean, it really almost looked colicky. And as soon as we pulled her off of it and back down to what she was supposed to have been on, it was fine. But that was a real note to self. Make sure who's ever getting the medication is, I gave it. Oh no, but I gave it also, type of, it was one of those situations, One of the things I learned firsthand, having gone through glandular ulcers, is that it can be a pretty time-consuming treatment protocol once you start adding in these multiple drugs. Because, and I get people come to me, we're talking about meals and when they're feeding, and I'll sort of ask them, well, when are you giving your medication? And there's sort of this silence and we sort of, have a bit more of a conversation, and it comes out that they haven't realized that they actually have to time their medication around their meals. And I think sometimes these conversations, I'm sure, are had in the field when the diagnosis occurs, but there's so much information, right, that they're getting, and they're overwhelmed, and they just miss little pieces, and they haven't heard all the instructions they've been given, or different people are feeding in the barn and medicating, and the follow through on the protocol they've been given is perhaps missed. So I was wondering if you could talk a little bit about Gastrogard. My understanding is it's supposed to be given on an empty stomach, and then you don't feed for a while, but then sucralfate's a little different. And then do you give sucralfate before you give Gastrogard or after you give Gastrogard? And, those kinds of things. If perhaps you could help our listeners kind of understand that a little bit and why it's important.
Yes, absolutely. And before I forget, I wanted to say, when you said it's time consuming or it takes a long time, I did also want to make the point that ulcers in the glandular region are slower to heal. They just are. And so 28 days is super uncommon for those to heal. And so I think the expectation, you sort of have to know that going in.
Yeah, we got the diagnosis with my horse. And my vet said to me, she said, don't even come back for 4 months. We treated him for a really long time before we rescoped him. But that was based on other horses she was seeing in our barn that had some similar ulceration. And she had been scoping them. One of them she'd been scoping on a monthly basis. And so she based that specifically for our situation based on other horses with similar issues in our barn under our management system at the time. And she said, we didn't really see an improvement for 3 or 4 months on this other horse. I would suggest you just don't come back for that long. But just to make the point that it can be a long process.
It is a long process. And I very often will scope rechecks of the glandular ulcers between 30 and 45 days. And I tell people, I do not expect them to be resolved. I just want you to know this is not your last scope. However, if we're not making headway, we need to change some things. And so sort of a different way of going about it.
And that's what we did with the pony. We did the pony after like 45 days. And to your point, nothing had changed. And so then at that point, we made changed something. Yeah, exactly. So yes. I've done it sort of both ways, but yeah.
But on the timing of the drugs, you're right. It's a lot to sort of throw at somebody. Your horse has ulcers and here are all the things that I want you to do. And often there are, beyond medication, there are feeding and exercise and management recommendations that are all thrown out there. It's nice to have something written. I think that's helpful. But sort of paradoxically, I guess, it's true that Gastrogard is best absorbed when given on an empty stomach. And then when hay is then fed 30 to 60 minutes later, the feeding of hay actually sort of activates, if you will, the Gastrogard. So you don't want to give grain an hour later. So the ideal scenario, this is what I usually do. I paint, here's ideal. Let's see how close to that you can get, right? So ideal is first thing in the morning, the horse gets Gastrogard, whatever time that looks like. 30 to 60 minutes later, is fed hay, and then at whatever time it works for someone to then give, if there are concentrates, if that's 30 minutes later, etc., then sucralfate can be given. It should be at least 30 minutes, and I usually recommend an hour between drugs. So we don't want to give sucralfate too close to Gastrogard or any other drug, but sucralfate does not need to be given on an empty stomach, only Gastrogard. I think that's one common little point of confusion. And so sucralfate can be given either with concentrates or can be just given by oral syringe an hour after giving the Gastrogard. But I do want the hay in there first. So Gastrogard on an empty stomach, then hay, then sucralfate, and then last time of the day, we're trying to get, so sucralfate is typically twice a day. There are some cases where it's given 3 times a day. Can be given up to 4 in more severe cases. But when we're going the kind of more common twice a day, we're trying to get 12 hours apart. That's often not entirely feasible, but it's not an antibiotic and we're critically looking at blood levels. And so if the sucralfate goes in at 7:30 and gets the second doses at 5:30 p.m., that's okay.
So I was just going to say, like, I keep my horses at home. I work from home. Like, I can pop out into the barn anytime during the day and check on them or feed them or do these steps. But I'm guessing for a lot of people, especially if they're boarding their horse, it's not realistic. So what happens then? Like, if they can't do it, or if the barn owner, I mean, it's a lot of work for a barn manager to try to follow all those steps also. Does it just not work, or try your best?
So you're right. I mean, that's why I think we sort of lay out, like, here's optimal. How can we get close to this? And I have worked with some barns where maybe the staff comes in and feeds 6 a.m. Well, there's not going to be somebody there at 5 a.m. to give Gastrogard, right? That's just not going to happen. And so we try to figure out, okay, what time are these horses fed? Let's find where they're going to be the emptiest, where somebody could give. And so I do work with a couple of barns where the Gastrogard is given an hour before the afternoon meal is fed, when the longest span between feedings, apart from the overnight one, if that's not feasible. And that's the best we can do, right? And then sucralfate is a little bit easier, right? Because sucralfate can be with food, and horses are fed at least twice a day. So that one's sort of not hard. It's that Gastrogard that's the hardest one, I think. And people who have their horses at home, hats off. And I have certainly rehabbed a few horses at my little farm in the very specific cases. And it is, I mean, I'm out there at 5 a.m., right? Giving Gastrogard before hay at 6. It's a lot of work, and it is really hard. So I can appreciate that question.
And I guess my other thing, like, how empty does the stomach have to be for this to be effective? Like, I feed enough hay overnight, so my ponies, when I go out in the morning, they still have hay. But that's not the case for everyone. I know that it just doesn't happen everywhere. So how many hours should they not have feed before getting this medication, ideally?
Several. And so really sort of overnight. And so in the case where somebody feeds like you do, where there's grass hay maybe left over in the morning, during the treatment period, I would actually reduce their nighttime meal so that there's not hay left over in the morning. I know it seems backwards, like, wait, don't we want to always be buffering stomach acid?
Right.
Why are we doing? It's a little crazy.
My nutritionist said feed lots of hay.
Well, I mean, we've all said that forever. So it was sort of something to walk it back and be like, you know what? Actually, don't do that. Please go right back to that once your Gastrogard treatment period is done. But to your point, like, does it have to be perfectly empty? Clearly not, because I have definitely scoped horses that it's not a perfectly empty stomach 1 hour after Gastrogard, that just the system can't be done that way, and their ulcers heal. So I do think they heal more rapidly, the closer to the ideal scenario.
And we just want it empty so that the medication's absorbed, correct? That's
correct.
Yeah. Okay.
Yeah.
All right.
Yeah, no, that's literally it. And it's an expensive drug to put in there and have it pooped out and not absorbed.
Right.
Yeah.
So kind of worth it. Yeah.
So I know how much Gastrogard costs. It's not cheap. And I'm guessing the other treatments aren't cheap either. So are there really no other treatment options? I mean, online we see people talking about other remedies like slippery elm, aloe vera, sea buckthorn. Like, are any of these other treatments, remedies, let's say, is there any merit to them?
There haven't been studies, which a lot of people are probably rolling their eyes at that right now. I get it. But I would tell you that in the many thousands and thousands of horses that I scope, I think I've scoped horses who have been treated with just about everything. There are also, in addition to the things you mentioned, there are a number of compounded preparations, which means there's no oversight in the manufacturing or truly what is actually contained within that compounded tube or tub or what have you. And I know people swear by certain things, and I honestly can't say if some things work. I can tell you that I have scoped horses who've been on just about everything and found ulcers.
Right.
And so what it leads me to believe, there's not one that I'm like, every time somebody says they have their horse on this X, Y, or Z, they're clean. I haven't come across something that I think really works. Now, not currently licensed in the US. There is an injectable omeprazole in Europe and in New Zealand that is, I know. It's super exciting.
Yeah, I've heard some really good stories about that. People had some really good luck with that in the UK.
And so I think when that is more widely available, there is a product in the US. It is not the same. It's not the same recipe, if you will. Anyway, that's an interesting one to sort of keep our eye on, I think, for the future, is an injectable option. It's a slow release, like a depot type drug. And I think that'll be really an interesting space to keep an eye on. But in terms of anything else that really helps, there are some supplements that have some science behind them that help support prevention of recurrence, but not treatment of active ulceration.
Yeah. And then to your point, they may help, but there is no magic bullet for stopping them coming back from an oral product you can give. I mean, like you said, you've scoped horses that have been on practically everything as preventative things, and there have been ulcers there. So to your point, there are a handful of things that at least have a little bit of research behind them suggesting they might help. So like I always feel from my standpoint, like I'm going to recommend something as a potential, let's hope we don't get back there again type of supplement. I at least go to the ones that have some research behind them. And I always say to people like you, I've heard of clients that have done this and they've still scoped and had ulcers, so it's not a guarantee, but it's our best shot.
Right.
So we just do the best we can. So if you've had a horse with squamous ulcers, and you just done your 28 days of GastroGuard, I'm assuming you need to rescope at the end. I mean, I get clients who come in and my horse was treated for ulcers and we did the treatment and now, and I say, well, did they rescope clean? And there's sort of this silence.
Right.
And then I feel really sort of awkward because I'm like, you didn't rescope? No. And my heart just sort of sinks.
I think the majority of the time I do recommend recheck. When I see really mild squamous ulcers, I know the GastroGuard is going to fix those.
Right.
And so in those cases, if we see really mild ulcers and we're sort of wondering, well, are these really mild ulcers the cause of the behavioral things you're describing? So in that case, what I tell people is, let's rescope to answer a question if one remains, right? So if at 21 or 28 days, again, with really mild squamous only ulcers, if the behavior hasn't changed, why don't we scope to understand, hey, look, the ulcer's cleared up and the behavior is still there. So that's an expensive way to learn that one, but then they know with certainty.
Right. But it has such value, right? It's expensive, but it's so valuable to know.
They know it's not the ulcers talking. And so sometimes we do that. I would say that's probably the only scenario where I don't recommend a rescope is incredibly mild, squamous only. I'm talking grade 1, or sometimes there are even things that I will grade under a 1. And those we'll kind of talk about. Let's try to answer a question to do this again. Everybody else, I typically do recommend repeating. Yes.
So I guess it's a nice sort of lead into a question I had, which was my daughter's pony. We scoped him multiple times. We tried multiple things for his pyloric issues that he was having. We did some hindgut stuff because we thought maybe this is inflammation that's coming up from further down the tract. That's, we've got whole tract inflammation. I turned him out for 6 weeks on pasture, but we happened to be going to Europe for that period of time. So he didn't get worked for 6 weeks and went out on pasture. We scoped him after that. Nothing had changed. But all of the behavioral things I mentioned at the beginning of the episode that he had been displaying, those had all resolved. In fact, we had successfully reshown him and he won and did very well. So he was back to his normal self, even though on scoping, he still looked abnormal. And I'll be honest, at that point, I sort of threw my hands up in the air a little bit because I was like, I don't really know what else to do for you. We've been dealing with this for the better part of 5 months, and we've tried multiple medication protocols. We've tried some hindgut support stuff. We tried turning you out, not working you, and you appear to be better. But the scope suggests nothing's changed. I know now if his little tells that things are starting to be a little bit uncomfortable, and I just really have my eyes open for that. But we stopped actively treating him for ulcers at that point, even though the scopes weren't clean in inverted commas.
Right. And so particularly with glandular ulcers, the tissue doesn't always go back to looking normal. It may be raised. There may be little polyps or nodules. It may be a little bit red, but that doesn't mean it's ulcerated. And so I think your point is a super valid one, that treating to clinical resolution is really the goal. Treating to picture perfect tissue is probably not an appropriate goal. But to be fair, we've learned this, right? since the advent of gastroscopes being widely available to veterinarians. And so this is all sort of newer information to be able to look at it and say, the animal's clinical signs are completely resolved and the tissue still looks abnormal. And indeed, if you biopsy, there may still be a little bit of inflammation present. But the current thinking, and certainly one that I agree with, is treating to clinical resolution. In cases that have had a really hard time of it, I do periodically like to recheck those. Like, okay, you've got this series of shows. Maybe you're traveling to East Coast from West and doing the circuit and coming back. Sometimes we will strategically scope just to understand, how are you doing? I know what you looked like before you left. And so 2.5 months later, how was that for you? And then really correlate that with the clinical signs. How is the horse doing? How's the weight? How's he acting? How's he feeling? So I think everybody who is scoping horses is sort of learning that. And obviously that's the art of medicine, right? That's not a diagnostic that comes back in the red, or that's not a box that's checked. That falls into the art of medicine.
Yeah, I thought of that earlier when you were talking about like the fact that you might not rescope those ones that had like the grade 1 or even less ulcers or whatever. And I thought that's a great example, right, of a clinician who really, that's also the art of it. It's just sort of knowing you've scoped enough horses, you've seen enough what it takes to resolve these things. And it's not black and white on a piece of paper check. That just comes from your gut knowledge as a clinician.
And I've been lucky enough to be able to scope so many, rescope, and really see so many variations. And I think that's sort of where how you build your art, if you will.
Yeah, for sure. Well, we've talked a lot about ulcers and what they are, the fact that there are different types with different treatments. So you need to scope, and the fact that you need to rescope perhaps before stopping treatment. And there are a lot of management changes that you need to make to try and prevent ulcers returning. But I think we'll save that conversation for next time because we've covered a lot of ground so far. But before you go, we have a listener question, and this is a complete about turn that I'm hoping you can help us with because it definitely falls under the area of internal medicine. So I'm hoping we can just get you to answer this question before you go.
Sure, no problem.
Sarah wrote in and she asked about testing her senior horse for Cushing's. And she says, I have an 18-year-old horse that's showing some of the early signs of Cushing's, losing his top line, urinating more than he used to. And I was going to get him tested, but then somebody told me that it's not a good time of year to test in September and October. But then I read somewhere else online that it is a good time to test. And so now I'm confused. Can you help? And I'm not surprised that she's feeling a little confused because I feel like in the time that I've been a nutrition consultant, the recommendations around testing at this time of year have changed several times as our knowledge and types of tests have changed. So what is the current recommendation about testing senior horses and potentially cushingoid horses or existing cushingoid horses at this time of year?
Right. You are right that the recommendations have changed as the body of knowledge and the testing has changed. So for anybody else who is confused, you're not alone, and there's good reason why. The current recommendation is perfectly fine and perhaps advantageous to test during this time. It's the time when the day length is rapidly shifting, right? And we all know that, like, wow, it's so dark so early. That day length, that photoperiod affects the pituitary gland in lots of animals, including horses. And so the pituitary gland is very, very active during this photoperiod change, making it, the testing, have a larger gray zone. So a horse who does have Cushing's, an untreated horse who has Cushing's, will have a very big response this time of year, a bigger test number of ACTH than they will in February, typically, say. And so I think it's a great time of year to test, provided everyone accepts that there is a wider gray zone. That gray zone, I suppose, is where the art comes in again, right? So a lot of veterinarians would hear a horse who's losing top line and urinating more than normal, and they would do their physical exam and maybe a little bit of other blood work, and they may decide, though your value, the horse falls in the gray zone, everything is pointing toward Cushing's, and they would say it would be appropriate to start. So using the baseline ACTH is actually a pretty handy thing to do this time of year. The TRH stimulation test, which is sort of that next level test to diagnose maybe a little bit earlier or cases that are not testing positive with that resting ACTH. It's trickier to do those this time of year. It's tricky for internists, right? And so in general, that is recommended against for this time of year. For horses who are currently receiving, who are, diagnosed Cushing's and on Presend, I think it's fine to test them this time of year. It's most helpful to have tested them this time of year before. If we don't know what their ACTH looks like in September, October, November, then it's hard to know what exactly to expect, if that makes sense. And when I'm retesting, I think it's worth saying when I'm retesting a horse, which I do, usually annually, horses who are receiving Presend for confirmed Cushing's, I try to stick to the same time of year, like we do an annual recheck of them. But that value is not the only piece of the decision-making process in terms of does this horse need an increase in the Presend level. The clinical picture, I would say, carries more weight than does that ACTH value.
Yeah, that makes a lot of sense. So it sounds like it is a good time of year to test, but doing the ACTH baseline and not so much the TRH stimulation and not to use it. It's more which test to use at this time of year. And I think that's where people get confused, right? Because they perhaps interpret don't use the TRH stimulation test as don't test at this time of year.
And the great thing is the horse owner doesn't have to know that, right? They're veterinarian, right? I mean, truly, like that's the veterinarian's job. And so a conversation with their veterinarian would be appropriate.
Yeah, I'm always telling people, you need to go have a conversation with your vet about blah, blah, blah. They're the ones that are going to help you know if this is worth testing for or not. Because as you say, too, it's a bigger picture than just a couple of symptoms. And, I'll bring that up with people in consultations. We'll be talking about an old horse and I'm hearing what they're saying and I'll just throw it out there. Have you had a conversation with your veterinarian about Cushing's or whatever? And they're like, no, I haven't. I'm like, well, I would encourage you to go talk to your veterinarian. They'll be able to see the big picture and they might be like, no, it's definitely not Cushing's for whatever reason they're seeing standing in front of them. But go and have that conversation because if it is, you want to catch it early.
So I think that's a wrap. Is there anything that either of you want to add or anything that we've discussed that you feel is particularly important that needs to be repeated?
Scope, right?
The answer is scope.
I don't know. I feel like it's so important, but I don't know. Phoebe, what are you thinking?
We certainly sort of touched on it, but I think worth maybe saying one more time is the management and nutrition is such an important piece of the puzzle, depending on the type of ulcers, the location, the severity, and the type of clinical signs. The sorts of things that you mentioned, Claire, with time off work, kicked out in a pasture, I think all of that's really important. I think it's important that we not forget the psychological component of gastric ulcers and then the associations that some horses make between the discomfort they feel from gastric ulcers and the things they're being asked to do. Certainly some horses do, right? When I go into the ring and they pick up the left lead, my stomach hurts. I mean, I'm not in their heads, but that's sort of and so I often counsel people a fair bit on ways to just kind of do a different routine and break things up a little bit after a period of really reduced work, depending on the severity of ulcers. So more that can be said about that, but I do think that's really an important piece of the healing process.
Yeah, and I had a personal experience with that. It was a real eye-opener, actually. The new horse that I have, I have a nice 2-horse straight load trailer. We loaded into it fine multiple times, went places. It was a little bit like when you got to your destination, a bit like walking a giraffe, right? Kind of very head up, looking around, where are we? Kind of like, he's a thoroughbred, so it's kind of thoroughbredy, in inverted commas, didn't think much of it. And then he got a little difficult to load. And I thought about it and I thought, actually, I think I need he's quite big. I need a bigger trailer. So I got a bigger trailer and loaded him up and off we went. And it's fascinating. I've only put him in it twice so far. But both times when I got to a strange location at the other end, his ears were the same height as his withers. And he just walked happy as a clam. And it was really interesting because I was like, I had always put down his I'm walking a giraffe type mentality to he was in a new place. I actually think it was stress from the trailer, like not being quite big enough for him. And it was actually the trailer ride. He got off the trailer like that because he had anxiety from the trailer ride. So those little things of places where tension creeps in, to kind of your point, you sometimes just have to, he was arriving at locations on edge. It doesn't really set you up for a great, then you're not set up for the whole weekend, right? When you're showing or whatever. So I'm fascinated to see how he continues to be now that we seem to have, and I would never have thought that was really a part of the problem, right? Or that was part of his thing. So that, I think sometimes it's really worth stepping back, to your point, and really evaluating. I had a client in Virginia recently who the horse was in quite underdeveloped top line, all the things. We ran through so many different things it could possibly be. And we walked the mare back in the stall, and she was in the second to end stall and just swung her head around, took the halter off, swung her head around, pinned her ears, and at the horse next door. And I said, does she always do that? And the owner said, oh yeah, they don't get along. And I said, well, maybe you could find her a new neighbor. And she said, oh, well, she doesn't really like anybody. And I said, well, then can you at least move her down so she's on the end stall so that she only has a neighbor on one side? Because she said, well, she doesn't like neighbors on either side. So, well, can you put her on the end? And then she can look out the stable door. She can see then out into the pasture, have a long view out, and she can pretend she's somewhere else more easily. And then, and then only have one neighbor. And she was like, oh yeah, we could probably do that. And I was like, if you have an ulcer issue and you're going to talk to your vet and go down that thing, this might be a big part of it. But seeing that every day, they just didn't see it because that's just who she was. And that was just, part of it. And they hadn't really appreciated that might be adding to her stress. So the management is huge. Well, thank you so much for helping us and our listeners and answer our listener question and sharing all your wisdom on the veterinarian side of gastric ulcer disease. And I love that you're so involved with, helping with the management and things too, because that is such a key component. And it's been a pleasure having you on, and we'll look forward to having you back in the future, hopefully.
This was a lot of fun. I think we could keep chatting, but we should probably wrap this up at some point. Thank you very much for having me.
Oh, you're welcome.
For our listeners, if you'd like to be a part of our conversation, please send your suggestions for future topics and equine nutrition questions to info@scoopandscale.com and is spelled out. You can also find Claire at clarityequine.com.
And if you enjoyed this episode, we'd be thrilled if you'd share it with your friends on social media, and be sure to subscribe on your favorite podcast platform.
For the Scoop and Scale podcast, I'm Jill Jackson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.